Welcome back to Just Vetting, where we go beyond the clinic, walls to talk leadership, ownership, and the real world challenges shaping veterinary medicine. Today, I'm joined by Dr. Peter Chapman, a dual board certified internal medicine specialist and a medical director of Red Bank Veterinary Hospital in Tinton Falls, New Jersey. Peter, thank you for joining me today.
Thank you, Peter. Happy to be here.
So Peter, you trained in the UK and built much of your career in the US. How did that journey shape you as to be the person you are today and the doctor that you are today?
That's a great question. I guess I should give you some background as to how I got here.
Yeah.
So I did my veterinary training in the UK at the Royal Veterinary College, which, got to add a quick plug, I think in the recent rankings, the RVC is rated the world's #1 veterinary school.
Mm-hmm.
It was a strong school when I was there. I will say I think it got stronger after I left. And I did a year of mixed general practice when I very first graduated. It was on the Isle of Wight, just off the south coast of England. And I always had an inkling that I wanted to do small animal work. I wasn't quite ready to commit. I came from a generation where we were influenced by a little bit of a cliche with the likes of James Herriot and all the mixed animal vets. And it was a difficult, almost like self-awareness that, hey, this wasn't where I was going to go, that I was going to be doing all dogs and cats. And I loved it on the island. Very quickly became apparent to me that horses and cows were not where it was going to be at for me. The novelty of driving around the countryside wore off quickly every time I had to step out into the mud, right, and proverbial fecal material and put my boots on. So I ended up applying for an internship back at the Royal Veterinary College, and I was really, really lucky to score that. And honestly, Peter, when I look at how difficult it is to get a good internship today, I feel incredibly lucky to have had the opportunities I have done. That was like late 90s, turn of the millennium, and certainly in the UK, not as many of us were going into specialty medicine as are now. And I look at all of the amazing candidates who are coming across my desk and honestly experience a large degree of imposter syndrome. Like, goodness, if my 1999 application was stacked up there, it would go right to the bottom of the pile. So
I think we all feel, Peter, I think, not to interrupt you, I think we all feel that way, whatever profession you're in. We talk about that here in my firm all the time, saying, geez, look at these resumes that we're getting, or that school that they're, it just,
I know.
You feel the same
It's
way.
Funny you say that. It's funny. And I try to give myself grace, as I'm sure you and your colleagues do. And I'll say it to my team members here when I say the same. It's like, well, hey, you know what? If you were applying in 2026 rather than 1996, you would have done all those things as well, because you would have pulled yourself to the top of whatever cohort you were in and made yourself stand out. But it's certainly a sobering experience. So I did a year there, and then I ended up doing an internal medicine residency for 3 years. Internal medicine had always been like a passion of mine, and I feel like I found my home. And then at the end of my program, I wasn't sure what I was going to do, if I was going to go into academia, perhaps do some research, perhaps go into a private referral practice. And then out of the blue, one of my mentors forwarded me an email from a contact of his at the University of Pennsylvania, Dr. Bob Washabaugh, who some folks might know, who was head of internal medicine at Penn for a long time and then went to Minnesota. And they were recruiting for 1-year positions as a staff lecturer. I'd heard wonderful things about Penn. Back then, I think it was probably rated higher than the RVC as a school. Like now, again, not so much plug there for the RVC, but it was a fantastic opportunity for me to go and expand my horizons, both professionally and personally as well. And I will say, I moved to Philadelphia sight unseen. I had not been to Philly before the day I arrived for the job. I came expecting to love the job, um, came expecting with some not necessarily universally great things I'd heard about Philly in the early mid 90s to not love Philadelphia.
Right.
But you know what? I love the job, and I love and still do love Philadelphia. I live in the Philly suburb still and commute across to Jersey every day.
Hmm.
Wonderful city, wonderful area. And what am I now? 23 years later, I'm still here.
You don't look it. That's wow. 23 years later.
Well,
That's great.
yeah, I know. I guess the camera's kind to me. Let's put it that way. I got a couple of filters on today.
Uh, so
And
so
then
you come across so talk about your again. I love how you start. So you start. So walk me through your journey as from where you started here. 23 years ago, and to where you are now in this leadership role, and how, I know because you just don't end up where you are now.
you
There's a
don't.
lot
So
in between.
I've always been someone who's looked for opportunities and tried to advance myself to the highest level I can do. And I've also always wanted to be in a place where I could have like more of an impact on the profession than from spending all day, every day in the clinic.
Hmm.
And that being said, I would never, ever, ever like want to like undervalue that. I love my time in the clinic. I feel like I made a huge impact, I hope, to my patients, their families, the referring veterinary community I was working with. Um, but I've always been looking for a bigger challenge and a change. And I think that change is good. So I was at Penn for 6 years, and then I moved to a practice in the Philly suburbs. I ended up being there for 16 years. And in 2020, the position of medical director at that hospital came open. At that point, we were a practice that was part of the Blue Pearl network, and I applied for and got that position right in March of 2020, which, if you may recall, was an interesting time like in the world. I think that my first day on the
To
job
say
was
the
actually,
least. Right.
yeah. It was like March 17th of 2020. It was literally Monday morning, and we were like closing the front doors and having people in the parking lot, and I was coming into the role. So it was a baptism of fire. And I will tell you, Peter, and we can talk more about it. I think when I took that position, um, I fortunately did not have a great understanding of what it took to be a good leader. And I say fortunately because I think if I had known what was involved, I think I probably would have thought twice about taking the position because I wouldn't have seen that skill set and those strengths like in myself.
Right.
And over the course of the 5.5 years I was in that role, I would hope that I learned to become a good and better leader. I learned more about what was involved, and again, we can talk more about that. And I ended up loving the challenge and wanting more of it. And the hospital that I was medical director of, we had around 50 veterinarians. We were I believe, the second largest location in the Blue Pearl network. And it wasn't clear to me what my next move would be and what I would choose to do next. For a long time, I'd thought that like that would be the hospital where I would stay and retire. But I found myself looking for more growth, looking for another challenge to try and keep things fresh, to try and push myself to try and learn more. And I saw the job here at Red Bank posted. Many of your listeners are probably familiar with our hospital. We are one of the biggest private specialty referral hospitals in the country, like if not the world. including our house officers, we have around 105 veterinarians. We have a staff in total of close to 500. We moved into a brand new building before I started here of about 107,000 square feet over 4 floors. And while I would not pretend for a moment that bigger is necessarily better, I think it all really comes down to the experience of our clients, the care we can give our patients, and the experience of our team. And that can come either in a small boutique environment or in a very large environment, such as we have. It certainly brings bigger challenges and also bigger opportunities. And I kind of received a random email and I got thinking about it and I decided it was time to take the plunge and see something different.
Yeah.
And I've now been here for 6 months and I have not regretted that decision for a moment. I'm working surrounded by a team of people who are committed to veterinary medicine and committed to providing like first-rate care on a level that I've never been before.
So you've been there 6 months, and you were at your prior role almost 4.5
16.
years. Yeah, right.
Well, I 5.5
right.
medical director in the
Right.
hospital for
Right.
16 altogether.
Yeah. How is your? You know, it's interesting how you talk about the leadership role that you kind of you applied for, you got, and you kind of evolved. How has your leadership philosophy evolved over this period of time?
I think the first thing that's a very clear distinction to me is the difference between being a leader and a manager. And I think too often we end up conflating those two concepts. And to me, learning about the difference and trying to exemplify the leadership qualities even over and above the management qualities, I think has been my biggest area of growth. And I think effectively, to me, your role as a manager is primarily, to some degree, and this is maybe distilling things down to too low of a level, but giving direction and instructing others on what to do. Whereas a good leader, and I'm not identifying myself in that category, I aspire to that category, but I think a good leader is able to build a strong culture that wants everyone to do their best and wants everyone to follow you for the better of the organization. And when I look back and you talk about my style, I see my role as doing everything I can, not to micromanage people, but to remove barriers,
right,
to allow our team to achieve what they want to achieve at the highest of their ability. They should be able to come to work, take care of their patients, get their job done in the easiest, most efficient way possible. And ultimately, that's going to be good for our business as well, because first of all, it's hopefully engaging for our doctor team. We're more likely to retain them for longer careers with us. We're going to spend less time recruiting new people to replace them because we've got less attrition. But also, if we are more efficient, then hopefully we can manage more patients and have a better client experience as well.
And that all makes sense. You obviously got to be confident in yourself in order not to wanting to micromanage others. I find with leaders, you just want to, like you said, let them do what they got to do. And I love what you said in terms of breaking down barriers for them, so that they don't feel like they're in an environment working with one hand tied behind their back. And if they have an issue, they know they can come to you. There's an open door. They can come to you, and you have to help them. And being in such a busy environment, and with the industry navigating burnout, staffing challenges, and and increasing case complexity. What have you found, if anything, that works in supporting the teams that you've been involved in? I think that's probably one of the bigger issues we find with a lot of our practice owner clients trying to navigate. You're balancing the workload,
Yeah.
and then obviously this burnout, and trying to balance that to run a productive business at the end of the day.
I think for me, the key is trying to fill the team with resources that let everyone be able to practice, as it were, at the top of their license. I think that much of the burnout comes from like real or perceived inefficiencies, or perhaps having to deal with things that we don't feel fall under our direct remit, whether that be handling clients who perhaps are higher touch, like have like higher needs, whether it be spending time like writing medical records, whether it be communicating results back to clients. I think all of those things and a myriad of other ones like all add up. And I think what I've seen be most successful is trying to provide resources. And again, it comes down to taking the barriers away, but to take like some of that pain away. And whether that's leveraging people through adding layers to our client service team. At Red Bank, we have a wonderful team here of like client liaisons on top of our client service team who will deal with like questions or concerns and help to address and manage those. I've seen success with like patient care coordinators in taking workload off the technician team in terms of calling for records, providing records, in terms of having a pharmacy staff to fill medications. And I think trying to fill those support roles to reduce the excessive load on the doctors and on the nursing team has been really, really helpful. I think also like where we can do like leveraging technology, and whether that's like more efficient systems, or we are within Red Bank and within the Ethos network of which we're part, trying to leverage AI more and more, for instance, for like writing medical records. And perhaps there would be folks out there who would disagree with me, but as an internist, I never would have imagined that my source of burnout would have come from doing another endoscopy or managing another diabetic. It's having to deal with all of the follow-on that goes on from that, whether it's dealing with callbacks, filling medications, writing the records that are associated with it. So the question is, how do we make all of those things more efficient to allow our teams to do like what they love and not get caught up in all of the noise around it, which admittedly all needs doing and all needs completing, but can often be done in a more efficient fashion.
Yeah, you said the word efficient a couple times there, and I think us as professionals, whether you're an accountant, an attorney, a veterinarian, or other professionals, people keep talking about AI replacing. I don't see it so much as replacing. I think it's helping us, all different professionals, leveraging it to be more efficient for the benefit of our respective clients. You're still going to need that professional there to understand what's going in and what's coming out. We were just talking about that internally at a meeting here at our firm. But to your point, how to be more efficient. And I think in any profession, yours in particular, there's a lot of things that people like to do and they don't want to do, but you got to do it anyway. Which I agree with you. That's usually the stuff that you don't want to do.
It's
Kind
the
of
stuff you don't
piles
want
up.
to do that makes
Yeah,
you
it
burn
doesn't
out.
get
So,
done, and
so
then that creates the
yeah,
stress, and there's the stress creates the burnout, right? I mean,
yeah.
it's a never-ending story.
I would love to say that, hey, like we could like leverage AI and to write all of our medical records
Right,
and we would all be home by 3 o'clock every afternoon. Like, let's face it, that's not going to happen. What's going to happen is we're going to use AI to write our records and it's going to free up time to allow us to see more patients and our day is going to feel just the same as it
right.
was, but it's going to be filled with more worthwhile, more rewarding work and more ability to help the pets out there, which has got to be a good thing
Right.
at the end of the day.
Well, you're not asking AI the right question. You should be asking AI, hey AI, how can we get all the work done by 3 o'clock and we get home? Then you should, I mean, whatever it
Yeah.
tells you, that's what you should be doing.
Maybe,
Yeah.
maybe,
Uh,
maybe.
so, so yeah.
I'm not sure I'm ready for the answer. Let's put it that way.
So you touch on that. You mentioned more rewarding work, and in your field, internal medicine, you're dealing with some of the most complex cases. What type of cases do you feel energize you, or what do you consider rewarding cases?
Honestly, I the most rewarding ones for me, um, historically have not necessarily been the ones where I have made a difference medically or made a huge like, diagnostic breakthrough, although I can think of those. The most rewarding ones for me have been the ones where I've been able to build a strong relationship with the pet's family. And I do think, honestly, that's part of what attracted me to internal medicine, like as a specialty. And we have as internists those long-term relationships, sometimes over the life of the pet. Honestly, sometimes over my career, over the life of multiple pets,
Hmm.
like within that family, and being able to form those bonds and make a difference for those families and feel that connection, um, to me is the most rewarding thing. And that connection can be on so many different levels, and it doesn't have to take time. I think that at the start of like every appointment, taking 15 seconds, 30 seconds, a minute to like acknowledge something about the day or the pet or where the client lives or whatever the logo on their t-shirt and their own business is and what they do can go so far to outside the human animal bond to building the human human bond, which for me is rewarding, but
Right,
along with that comes the building of trust between the veterinarian and the client, which is going to pay itself back in spades. Number one, obviously, in terms of the success of medical care and the understanding and compliance with medical recommendations, be they treatment or be they diagnostic, but also honestly in a cold-hearted way on a business level that folks are going to bond with you, they're going to want to come back, they're going to want to refer
they're
others to
comfortable,
you.
right? They feel
Yeah,
there's a comfort level there. You're
yeah,
taking care of one of their family members, and they
yeah.
know they can what you say that you can they trust. Yeah,
And you know what? When things do, which sometimes happens, not go according to plan, whether
right,
it's medical care, whether it's client care, there's an awful large deposit at that point in the trust bank, like, and you can work through those things together, and
right.
things work out okay. So for me, that's where the reward has come from, and it's interesting because I'm in my new role, my time on the clinic floor is very limited. And many people have asked me, well, hey, like, do I miss it? And I do, I do miss those bonds and miss those connections. But actually, as a leader, I feel like I'm using many of the same skills on a day-to-day basis as a medical director as I was as an internist.
Right.
It's listening, it's relationship building, it's compiling the data and trying to identify the problem and make the diagnosis effectively, and then trying to come collaboratively to a solution and the best course of action. So
Right.
to some degree, it's the same skill set applied in a different way.
Right. And as a leader, there are going to come times when you need to make a difficult decision. And to your point, by creating those relationships as you're doing, you're building up a lot of trust in that deposit bank. It's just a different bank. Same type of deposit you're making. Right.
You've taken my analogy further, and I love that.
Yeah. But it's so true, because
Yeah.
when a difficult is, if I, as somebody who, I'm from working for, you trust and you understand, hey, I hear what you're saying. This is not the direction we want to go. We want to go this way, rather than maybe confronting you about it. Just say, you know what, Dr. Chapman, yeah, I get it. That makes sense. Let's go. And then, so it makes sense. What would advice, talking about your passion for internal medicine, what advice would you give to someone considering a specialty in internal medicine?
I would say the advice I give to anyone, well, let's turn that around. If someone comes to me asking me what specialty I think they should go into, then I worry that they're looking at it the wrong way.
Mm-hmm.
I think that you have to go through further specialty training because you have like an innate passion for that specialty, whether it be internal medicine, whether it be surgery, whether it be neurology, whether it be like ophthalmology. So I think it's got to come not from hey, and I want to specialize, what shall I do? But I love this topic. I want to explore it to the best of my ability, because that's where success and fulfillment and satisfaction is going to come from. If somebody came to me saying that they wanted to do internal medicine, I would 100%, my advice would pure and simply be like, go for it. And what can I do to help you and support you and assist you? Because I have loved everything that I've been able to do. Again, we've talked about the diagnostic things, we've talked about the client relationships, and I love seeing future veterinarians come on and take on that challenge. I was very, very lucky in my last role to also be director of our hospital's internal medicine residency program, trained multiple residents over the years, and that honestly was one of the most satisfying parts of my role as well, being able to pay it forward and hopefully like share that love and share that passion for internal medicine, and to try to teach people not to do it my way, but like how to think. And I would love having a conversation with my mentees when they came to the table with their own ideas and why don't we do it this way? How about this? And to make me think.
Yeah, exactly. Because there's I always say, like go as in law, as in medicine. You talk to three different veterinarians, you may get three different opinions on how to approach.
Four opinions.
Four opinions. That's even better, right?
Yeah.
So,
Yeah.
You know what? I always say in law you get three, but probably in my world you probably get 10 because they can't stop talking. So I get it. It makes fun. You're right. I mean, it's very rarely in these types of professions where it's one size fits all. So it's good. I love how you embrace that as opposed to saying, no, we're going to do it this way. This is how it's got to get done. Listen, the decision at some point has to be made, but you're willing to listen and say, hey, if there's a way to do it better, more efficiently, I'm all in. Let's see how we can make this work. Where do you see the trends in specialty medicine going over the next 5 to 10 years? I know we talked about AI. I think we're all talking about AI in our different professions and how it's going to impact us positively and negatively. What other trends other than that do you see taking place?
So I think one of the biggest, I think that the trend that I see is a growing demand for specialty medicine. And one of the challenges behind that is we need to find a way to ensure a good pipeline of those specialists coming through.
Mm-hmm.
And there are certain specialties, honestly, like internal medicine, like amongst them, surgery as well, where I feel there is like a good, strong pipeline with lots of training programs. There are other specialties that I think are struggling more. And while I perhaps like shouldn't name names and get on my soapbox, historically amongst the more difficult specialties to recruit from have been like anesthesiology and ophthalmology. And interestingly, both of those are specialties that require multi-species training.
Mm-hmm.
So a board certified anesthesiologist who's working in our hospital with just dogs and cats needs to have been trained extensively in horses and a variety of other species as well, and ditto for ophthalmologists. And that narrows the field dramatically of hospitals that are able to provide that training and provide, honestly, the specialists that we need. So I
Mm-hmm.
guess the first trend that I would see is a trend towards a pipeline which isn't supporting all of our needs. And I think there is a role for the specialty colleges there to look at what their mission is and try to figure out how we make that better. Because the question is the mission to act as a gatekeeper to certification and specialization, or is the mission to improve the medical care which is available to the general population within that specialty, in which case we need to have some like gatekeeping function to ensure that newly graduated specialists reach a certain agreed upon basic standard. But we can't be creating barriers that inhibit our ability to train people and bring them into the workforce and being able to provide that care.
Yeah.
So I guess first thing I would say is pipeline. The second thing is I am seeing, and I feel very mixed about this, a trend towards more super specialization, shall we say, and or subspecialization. 10 years ago, if someone had said to me, hey, like that's the way human medicine is going, that's the way we should take veterinary medicine, I would have been open to that discussion. I think as a profession, we have to be very, very careful about using a human model, a human medicine model, as a model for where we want our profession to be. I've had the misfortune, which I'm sure you and many of your listeners would have done, of having family members involved in the human healthcare system.
Yeah.
And there is a very, very sad absence of joined up care. I use frequently the word holistic, and I feel like holistic gets a bad name and gets mistaken for alternative. But to me, holistic medicine is medicine which is applicable to the entirety of the patient, like both the entirety of its body systems, but also the emotional well-being as well. And hey, we can extend that to the family as well. And I think that our profession has been very, very, very good at providing that holistic care. And so I feel inherently a little bit uncomfortable with the creep towards too much subspecialization. I think there will always be a place clearly for subject matter experts in X, Y, or Z disease. But I think we need to be very, very careful about becoming too specialized and losing sight of who we are and what our profession is wonderfully good at.
Peter, I was going to ask you one thing. If you could redesign within the industry to make it bigger, better and more special, you just give me like 3 or 4 of them, and so I know I appreciate that. And it is obviously a lot of good things happening, but there's, to your point earlier, there's always ways you can continue to improve, as opposed to this is how we've always done it.
Yeah.
You're a busy guy. You're obviously, you're running a large team at your practice, have a family. What do you do for fun? In your spare time? How do you relieve stress? Doesn't sound like you have any because you're so. And I'm not saying this because you're so passionate. It's clear how passionate you are and how much you love what you do. And so many of our clients, which is one of the things that really excites me about working in this industry.
Yeah.
People are tired, they work hard, but they found their calling maybe at 9 years old or 8 years old or some young age, and there's like no regrets there. Where you've talked to other family members in other professions, they dread going to their job. Where you can it just oozes out of you how passionate you are about doing what you're doing.
First of all, I would dispute your premise that passion is a panacea for stress, and to some degree, I would argue the opposite, because if one is not passionate about something, it's very difficult to be stressed about it because it doesn't matter. Yeah. But I'm passionate about our hospital providing the best care that we possibly can do. I'm passionate about our team succeeding at the highest level. I'm passionate about the sub-teams in our hospital all like collaborating well together, functioning as cohesively as possible. And with that passion, honestly, comes stress, because it's difficult to separate that passion from perfectionism in wanting everything to be just so, but also in terms of juggling multiple balls at the same time, trying to make all of those things happen. So stress comes along with that. But to answer your question, the best panacea for stress, for work stress, I should say, is for having 2 teenagers at home who, as soon as you walk in the door in the evening, have zero respect or recognition for anything that has happened, is happening, will happen at work. And it becomes, fortunately, relatively easy to then be distracted by a different form of stress in terms of raising 2 teenagers, and to switch off and go into home mode. So I think a supportive family around you is key. My wife is wonderful and will listen to me venting about work, but is also not in the veterinary field. She's a school teacher, which another absolutely wonderful and valuable profession. And so we have relatively little shop talk at home, which is wonderful. I also, honestly, I like to keep myself busy. A lot of that comes from like trying to keep myself fit and exercising. My wife believes that I'm marginally obsessive, but I love to run. I love to bike. She's come to realize over the course of our marriage that if I don't get out and do those things, I'm not necessarily showing up with my best personality, let's put it that way. And she's very graciously, I have a week of PTO starting middle of next week, and I'm heading off to Colombia, South America, for a 1-week road biking trip in the mountains above Medellin with a bunch of local guys who I ride bikes with. So I think getting away, for me, being outside, which goodness with the weather right now is very, very difficult to do, but just allows me to to reconnect and detach.
That's great. And I feel the same way when people ask me about, what makes you, how, what makes you successful, or how do you do what you do? First place I pivot is my wife and my kids. You can't,
Yeah,
it all starts at home, because without their
yeah,
support, I don't think, it'd be very difficult to do what we do. One,
yeah.
and two, I love the analogy with the kids. I feel the same way. So mine are a little older than yours, but I know I'll get a text now or a FaceTime, and just different issues or different questions. I sometimes I do get asked now, "Hey, are you in a meeting?" I
Yeah.
never used to get that before. It was just like, "Hey, Dad," boom, right into it. I'm like, you're trying
So
to
question
juggle,
for you,
right?
as
Yeah,
they get older,
yeah,
um, do the text responses go beyond the 2-word okay or the 4-word good?
yeah.
Are there more fulfilling conversations?
Sometimes, let me tell you. So
Sometimes.
there's a whole nother language they speak that I don't.
Yeah,
All I say to my wife, "What does that mean? I don't understand
yeah.
it." Makes me really feel old. So it's good. So Peter, I know you mentioned you're going to be heading out on PTO, and I truly wish you have a great time. You've definitely earned it. I appreciate you joining me here today on Just Betting. I appreciate you spending the time and just giving your providing your background and your experiences. I really appreciate it. Where if somebody wants to learn more about you and Red Bank, where can they go?
So Red Bank Hospital, we are active on social media. We're on Instagram, we're on Facebook, we're on LinkedIn. If anyone wants to connect with me, I'm on LinkedIn. I'm sure you can probably share my LinkedIn page,
Yep,
like in your show notes. I'd be happy to hear from anyone with comments or questions.
great. Peter, thank you. Really appreciate it. To our listeners, see you next time.
Thank you, Peter.